Okay, so welcome everybody to Why Hearing Loss Matters to Our Health, an introduction to over-the-counter hearing aids. I'm Michelle DeStefano, the Director of Audiology at the Center for Hearing and Communication. And with me today is Lauren Capua, our fourth-year audiology resident, and Carolyn Stern, the Director of Outreach. Lauren will be doing the presentation, but we are here for any questions or to answer any concerns you may have as well. Go ahead, Lauren.
Okay, so as Michelle mentioned, I'm Lauren. I'm the fourth-year audiology resident, and today we're going to talk about over-the-counter hearing aids. So on today's agenda, I'm first going to start off by talking about our organization, the Center for Hearing and Communication. And then we're going to discuss over-the-counter hearing aids, including what they are and updated information about them. I'm going to go into detail about differences between over-the-counter hearing aids, as well as prescription hearing aids, which are the ones that you would purchase through an audiologist. And lastly, we will discuss the importance of hearing testing, candidacy for over-the-counter hearing aids, and tips when considering over-the-counter hearing aids. And then at the end, we'll have any questions that you have. We'll definitely all be very happy to answer. And as Michelle mentioned, you could also put any type of questions in the chat box as well, and we could address those. So a little bit about the Center for Hearing and Communication. Well, we used to be known as the League for the Hard of Hearing, and we're a nonprofit organization that's based in New York City, but we also have another location in Fort Lauderdale. And our mission is to provide high quality, comprehensive service in order to empower people affected by hearing loss, deafness, or listening challenges so that they can have communication without limits. And we have several programs within our facility, which include our outreach program, as well as audiology, emotional health, speech and language services. And we also have an extensive family resource center, which provides information and support so that parents and family members can make informed decisions and address their specific individual needs. So the first thing we're going to discuss today are some typical signs of hearing loss. So the first one would be if you say what frequently. In other words, if you're really noticing that you need to ask for lots of repetition, then that can be a sign that hearing loss may be present. Other signs include difficulty hearing from another room or difficulty hearing on the phone or TV. So if you're a person who tends to increase the volume to a higher volume on your TV or your phone, that again may be an indication that hearing loss is present. In addition, you may have more difficulty understanding in noisy environments like a restaurant or in group settings. And it's important to know, as we age, communication in background noise does become more difficult, regardless of having a hearing loss or not. However, if it does present as a difficulty for you, that definitely could not also be an indication why hearing loss may be present. Another sign is complaining that others are mumbling, as well as having difficulty understanding if you can't see the person's face while they're talking. And lastly, if you tend not to be present in conversations or avoiding group outings because of maybe a potential fear that you have that you're not going to be able to understand the conversation, that is another sign that hearing loss may be present. Now, I put this slide in the presentation because I really want everyone to understand that no matter the level of hearing loss, really if it's left unmanaged, it really can impact your overall health. And there's many risks of untreated hearing loss. Some of these risks include being 2 times more likely to develop dementia with a mild hearing loss, and 5 times more likely to develop dementia with a severe hearing loss. In addition, there's a 50% greater chance of depression and 30% greater chance of an accidental fall. So really, as severity of hearing loss increases, so does the risk of falling. And it's also important to know that there's an association between diabetes and hearing loss. So people who have diabetes really tend to have that greater risk of hearing loss. And interestingly, it's also good to know that cardiovascular disease can also play a part in a potential hearing loss, because if there is reduced blood flow to the ear, it can cause damage, which really results in that hearing loss. And I bring this all up because when hearing loss is managed, the chances of these risk factors really do decrease. So specifically in a study that was done, it was found that when you do wear hearing aid, when you do manage your hearing, it really does decrease that chance of dementia. It decreases the chance of falls and anxiety and depression. But even though there are these risks of untreated hearing loss, unfortunately, there are many reasons why people delay hearing loss treatment. And the two most common reasons why this really happens is because of stigma and cost. So people tend to have like a negative perception that hearing aids will make them look old or disabled. I'm sure you guys heard that over your time. But some people will say, also that it may feel like it's because they think they're vain and they don't want people to see their hearing aids. But fortunately, there are hearing aids available that do look more discreet behind the ear, as well as hearing aids that go inside the ear to eliminate this problem. And here's why I wanted to stop to just show you guys. So here is a little hearing aid that goes behind the ear. This is a dummy of one. And it's rather small. So it does go discreetly behind the ear. I know it's hard to tell from this angle, but it does go behind the ear. So it is more discreet than some might think. I don't have one that goes in the ear, but I do have a little dummy of an ear. And as you can see, there would be a hearing aid that would go inside the ear over here. And depending on the hearing aid that you get, it also could be more discreet inside of the ear. So those are just options that I want you guys to be aware of. And in addition, people often feel that cost is an issue because they may feel that hearing aids are more expensive. And it's important to know, though, that most insurance companies really do have a hearing aid benefit with your insurance. So, for example, there's many private insurances that will allow you to have a portion of the hearing aid benefit covered by your insurance. In addition, specifically with Medicaid, they typically cover one hearing aid in New York State, and Medicare doesn't cover hearing aids, but they do cover hearing tests. There are Medicare plans, managed Medicare plans, that also do cover a portion of hearing aids. So it's important to know that even though they may seem expensive, there are avenues so that you would be able to get a discount or significant coverage for your hearing aids. And of course, if more people really wore hearing aids, then hearing aids would become more acceptable and help reduce that stigma. And I've seen, even at my time at CHC, we had Center for Hearing and Communication. There's a lot of patients who come in and they say, oh, I'm here because my friend was here and my friend had a lot of success with their hearing aids. And so that made me want to come in. So in order to reduce that stigma and having more people get hearing aids definitely helps, again, reducing that stigma. So as many of you guys know, over-the-counter hearing aids became available in October of last year. But how did they come into place? Well, the Over-the-Counter Hearing Aid Act was signed into law over 4 years ago. And this act allowed for the FDA to create a new category of non-prescription hearing aids. These hearing aids are really considered non-prescription hearing aids because they are SelfFit hearing aids. And this means that they're determining, really, the person who purchases the hearing aid is determining what levels they should be hearing certain sounds. And these hearing aids are also only for adults. So that would be people 18 years and older with a perceived mild to moderate hearing loss. A person with a worse hearing loss will not benefit from these devices. And we're excited about the availability of new options for amplification hearing aids, because we hope that people will be inspired to take action and manage their hearing loss. So as I mentioned, over-the-counter hearing aids really did launch in October 2022, and these over-the-counter hearing aids are SelfFit, which means that you could purchase them on your own, and you could fit them on your own. In addition, as I mentioned, it's important to know that these hearing aids are specifically designed for people who have a perceived mild to moderate hearing loss. However, it's important to say with that without a hearing test, you're not really able to determine if you have a mild to moderate hearing loss. So in other words, you're not really sure if the over-the-counter hearing aids will be appropriate for you unless you receive a hearing test, because then you're not going to know, do I have something worse? Am I going to fit this criteria that the over-the-counter hearing aid is allowing me to fit into in order for it to benefit and work for me? So it's something to really consider. And again, as I mentioned, 18 years and older, and I'll mention why this is very important in just a couple of slides. So over-the-counter hearing aids are available online and in retail. So you're able to purchase them at the store, and you do not have to have a hearing test or prescription from an ENT in order to get these hearing aids. Now, the whole thing with that is that, again, we really want to make sure that these over-the-counter hearing aids are appropriate for you. Without a hearing test, you're really not knowing if it's truly appropriate. In addition, some products are going to require a smartphone for setup and controls. So in order to fit the over-the-counter hearing aid, you're potentially going to need a smartphone in order to fit the hearing aid on your own. And if you don't meet that category, if you don't have a smartphone that you're able to use with the over-the-counter hearing aid, it's a possibility that you might not be able to use the over-the-counter hearing aid that you purchase. So it's important to know what you need with the over-the-counter hearing aid in order to actually make a decision on if you're going to purchase it or not. In addition, it's important to check the return policy and the warranty, and I'll step back a second, because hearing aids typically come with a repair warranty, which means if there's anything that is wrong with the hearing aid, if the hearing aid becomes broken, if the hearing aid doesn't sound right to you, you're able to send it in for a repair normally if you were to get it from an audiologist. However, with over-the-counter hearing aids, it's possible that they might not come with a warranty, or if they do come with a warranty, it's going to be a very short warranty. So all in all, you really should understand what your over-the-counter hearing aid comes with as far as a warranty, so that you can make an informed decision on whether you think it's best to purchase one because of how long you would have to repair it if you think that would need to be the case. In addition, I do also want to let you know that studies have shown that people do not often accurately determine that their hearing loss, they really don't accurately determine their hearing loss level and tend to underestimate it. So if you do program your over-the-counter hearing aids, the thing is that people typically will fit them for comfort versus optimal benefit, because you're used to hearing a certain way. If you have hearing loss, you're used to hearing in a certain way, used to making it be more comfortable for you. But really in most situations, you need that amplification. You need things to be louder. And so if you're fitting for comfort, you're not necessarily getting the full benefit of the hearing aid. So it's just something to consider. An audiologist, however, is going to guide you to that optimal fit, is going to know what hearing loss you have, is able to determine what the best programming is for that hearing aid, and then it's going to fit it ideally so that you get the optimal benefit out of your hearing aid. And again, as I mentioned, a hearing test is really highly recommended by an audiologist, as well as medical clearance for amplification or hearing aids by an otologist or an ears, nose, and throat doctor. So it's really recommended, again, because of a couple of reasons. And the reasons being are, we want to help to establish a baseline to refer back to. So, for example, if you do get a hearing test and you know what your hearing loss is, or if you don't have hearing loss, and then a couple of years later, or even a year later, you notice that there is a change in your hearing. If you had a hearing test beforehand, you're able to determine, okay, did my hearing loss change, because you already had that hearing test to begin with. So that's why a hearing test is highly recommended, so that we know where to refer you to if there are changes to your hearing. One of the places that we may refer you to because of a change to your hearing is an ears, nose, and throat doctor, because when there's a change in hearing, there's a possibility that there are other health issues that could be occurring. And so that's why we want to make sure that the hearing test is really just another piece of that puzzle in order to determine what is going on with your health. And also, a hearing test is important because we want to help provide proper guidance on the best device and care. So when you do get a hearing test, what we're doing is we're seeing, okay, how severe is your hearing loss? And based on that, what hearing aid is best for you? Because depending on the type of hearing loss, we would choose a particular style of hearing aid that would fit your needs. So it's important. So with that being said, if you were to never receive a hearing test and you did decide to purchase an over-the-counter device, if your hearing loss was worse than what is the perceived mild to moderate hearing loss for an over-the-counter device, there is a possibility that it's not providing you, it's not the right type for you, and that it's not providing you, again, with that optimal benefit. So if anything, again, a hearing test is important just to know what your hearing loss is and determine if you are a candidate for over-the-counter hearing aids. In addition, as I mentioned, hearing loss is sometimes often progressive in nature. So if your hearing loss changes, again, we want to have that baseline, but if your hearing loss changes, it is important to know if there was that change so that we can make further recommendations. And what the good news is that most private insurances and Medicare and Medicaid cover hearing tests. So now I really just want to go over the differences between over-the-counter and prescription hearing aids. So the first thing, as I mentioned, over-the-counter hearing aids you purchase through online, you could purchase retail. But a prescription hearing aid is dispensed by an audiologist. And there's a reason for that. And that reason being is because with an audiologist, we're the ones that are programming. We're providing you the selection. We're determining what hearing aid is appropriate for you. We're determining we're the ones that are programming the hearing aids based off of your hearing loss that you had that test for, the hearing test. So the audiologist is really guiding you through the whole process. Whereas with self-fitting hearing aids, you're the one that is fitting the hearing aid. So we're kind of left out of the equation unless you consult with an audiologist about your hearing status. So again, you might fit that hearing aid based on comfort versus optimal fit. And again, a hearing test is not required for over-the-counter hearing aids, but it is required by an audiologist because that's the way that we would determine what hearing aid is appropriate. In addition, the types of hearing loss are perceived to mild, perceived mild to moderate for over-the-counter hearing aids. And for a prescription hearing aid, it's all degrees. So regardless of the hearing loss that you have, past moderate, so it could be a more severe hearing loss, an audiologist would be able to fit that because, again, we're the ones that are programming the devices. So we would be able to determine the type of amplification that you would be receiving. We would be able to program it based on the severity of your hearing loss, whereas over-the-counter hearing aids are not equipped to be programmed with more severe hearing losses, which is why it's only in that perceived mild to moderate range. In addition, as I mentioned, over-the-counter hearing aids are for 18 years and older, whereas prescription hearing aids are for all ages. And the real reason for this is because for children who have hearing loss, it's really important that they develop proper speech and language. And so we need to determine the severity of their hearing loss so that they have the optimal benefit. They have that ability to do well in school, to develop that speech and language. So it's very important that they be seen by an audiologist and we understand what type of hearing loss they have and the severity of the hearing loss so that they could have the best success throughout their life. In addition, for over-the-counter hearing aids, they're not covered by the insurance. But as I mentioned, for prescription hearing aids, some insurances are going to be able to cover maybe even all of it or a partial amount. And again, for Medicaid, it does cover a hearing aid in New York State, but for Medicare, it does not. However, with Medicare, there are managed care Medicare plans that you could receive a hearing aid benefit through. And both of them are FSA, HSA eligible. So now we're going to be talking about the costs. So you might be wondering, well, how much are OTC hearing aids compared to prescription hearing aids? Well, over-the-counter hearing aids are roughly between $700 and $1,200 per pair, and prescription hearing aids are about $1,800 to $6,500 per pair. And these prices are dependent on the level of technology that's in the hearing aid. What I mean by this is that there are different chips in the hearing aids that allow them to do more things. And the more things that are in that chip, the more the hearing aid is going to cost. So for over-the-counter hearing aids, the higher the cost, the more chances you can make, the more changes you can make to your hearing aids. And for prescription hearing aid, the higher the cost of the hearing aid, the more adjustments the audiologist, again, is able to make, and the more help that you're going to be able to receive understanding speech and background noise. So there are different elements that you're able to receive more benefit from with the prescription hearing aid, and also at a higher price point. So now you may be thinking, well, besides the technology that's inside the hearing aid, what else makes the price point between over-the-counter hearing aids and prescription hearing aids different? Well, again, the over-the-counter hearing aid, you're the one who's fitting the hearing aid. So you're the only one. So you're the one that's fitting it, and you may or may not be fitting it to your hearing loss because, again, you may be underfitting it to your hearing loss. It will also likely come with a repair warranty. But again, every company has different warranties, so you need to just be aware and check your warranty and return information. And there's also no loss and damage warranty. So if you lose the hearing aid, or let's say you step on it and it gets damaged, that's it. So you can't get it replaced and you'll have to pay for another one. So again, there's just these differences between the over-the-counter hearing aids and prescription hearing aids, and the price point of the hearing aids is really determined based on what's included with the hearing aids that you're getting for over-the-counter that you're purchasing, or prescription hearing aids that an audiologist would be able to provide for you. So again, with the prescription hearing aids, the reason why they are at a higher price point is again because of the services that you're receiving, and because of the technology that is included in the hearing aids. So when you get a prescription hearing aid, it's being programmed to your prescribed hearing loss, again, by an audiologist, but you're also receiving counseling on the device and care and maintenance. So when you get the hearing aids, we're the ones who are able to help you take care of it. We're able to show you how to wear it. We're able to show you how to clean it. We're able to walk you through the hearing aid process and being able to wear it and understand what it does and the features that are included with it. Whereas with the over-the-counter hearing aid, you're the one who's in control of the over-the-counter hearing aid. You don't have that helping hand. In addition, what's good is that it helps you stream with the prescription hearing aids. You could stream audio to your phone. You could use Bluetooth, so it's kind of acts as like an AirPod, let's say, because you're able to stream music to the hearing aids. You're able to stream music, stream phone calls, all of it could be connected to your phone from your hearing aid. So it's just an extra thing that also comes with prescription hearing aids. And in addition, you're going to have a repair warranty that's going to be set up for you, and the audiologist is going to explain what that repair warranty is. And you're also, if you do lose the hearing aid, you will also have a loss and damage warranty. As I mentioned with over-the-counter, you're not going to. So there are reasons why someone would not be a candidate for over-the-counter hearing aids. And I just wanted to let you know some of those reasons. I should point out that if you did decide to purchase an over-the-counter product, there will be a warning on the over-the-counter product that will be able to tell you maybe some of these things that are listed here as to reasons why you wouldn't be one. But here they are. So the first one is tinnitus, which is a ringing, a hissing, or buzzing in the ear. It could be in one ear or it can be in both ears. If you do experience tinnitus, it's important that you not only go to an audiologist, but also be seen by an ears, nose, and throat doctor to determine why this tinnitus is occurring. In addition, if you hear better in one ear versus the other, that's another reason why you would not be a candidate for an over-the-counter hearing aid, because over-the-counter hearing aids are only for those who have symmetrical hearing loss. And again, it's hard to know if you have symmetrical hearing loss if you do not get a hearing test. So it's just another reason why it's important to get a hearing test. In addition, if you have any pain or fluid or discharge in the ear, we don't want you medically to have anything on your ear until that is all cleared up. And again, in order to do that, you would need to go to an ears, nose, and throat doctor. So definitely that would not make you a candidate for an over-the-counter hearing aid until you were seen for that and you were treated properly. In addition, history of ear infections or excessive earwax for the same reason. We need to make sure medically that you're able to properly be fit with the hearing aids. In addition, if you have vertigo, which is dizziness, that's another reason why you would not be a candidate, because I won't go into it in depth, but hearing loss and dizziness are definitely associated with each other because they all are in the same wheelhouses medically. So it's important that if you do experience dizziness, again, that we don't wear hearing aids and that you go to see an ENT or otolaryngologist before wearing any kind of product and before you purchase an over-the-counter hearing aid. And again, another reason is because if you do have a sudden change in your hearing or a sudden hearing loss where you notice an extreme change in your hearing, we want to know why you're having this extreme change in your hearing. So we wouldn't want you to be fit with an over-the-counter device. We would want you to go to the ENT, who would then also require you to go to the audiologist to determine what your hearing loss is. And then here are some over-the-counter hearing aid tips that we have. So the first thing we want you to do, as I've been mentioning throughout this presentation, is to get tested to know if you're officially a candidate. Because over-the-counter hearing aids are really for perceived mild to moderate hearing loss, we want to know if you meet that category. So if your hearing loss is worse, then you would not be a candidate for over-the-counter hearing aids. In addition, we want you to know the features. We want you to read the warnings. So we want you to understand what is included in over-the-counter hearing aids so that you can make the best informed decision on whether this hearing aid is really going to be appropriate for you. On over-the-counter hearing aids, as I mentioned, there is a little warning that will indicate if the over-the-counter hearing aid is appropriate for you based on if you're a candidate or not. And reasons why are the ones that I explained before with the tinnitus and dizziness and sudden change in hearing loss. So it's important to read the warnings, and also important to know what is included with your over-the-counter hearing aids, including if there is a repair warranty, or if I do lose the hearing aid, am I able to get another one? And with over-the-counter hearing aids, unfortunately, you're not, but you would want to know if you'd be able to get it repaired again. In addition, you want to know your insurance coverage, because even though over-the-counter hearing aids are not covered by insurance, there is a potential benefit that you would be able to receive a prescription hearing aid, and also have a hearing aid coverage that you would be able to receive at an audiologist's office. So you should be aware of what hearing aid benefit you have with your insurance, so that you know what, so that you're able to understand, okay, I'm able to receive X amount of money for a hearing aid, and therefore maybe it's a better idea to go with a prescription hearing aid because I do have coverage for that. And then you also want to make sure the device is labeled by labeled and has FDA approval, because there are hearing aids out there online that they say that they're hearing aids, but in reality, they're not hearing aids, they're just amplifiers. So there are products out there that are not FDA approved as over-the-counter hearing aids. And you need to make sure that you're not buying something that isn't even an over-the-counter hearing aid. That's just something that's going to just make sounds louder around you. In addition, you want to give it time to adjust, and you want to try out the hearing aids, because our brain really needs to acclimate. Whenever you put on a hearing aid, it's going to sound loud. Your own voice is going to sound loud to you at first. You're going to notice different changes that sounds in your environment that you may have not experienced before. And it's important that you really give yourself the time to adjust, and your brain time to adjust, so that you're able to receive the benefit that you would be getting from the hearing aids. So definitely don't just decide to take them off after a couple of days. Definitely give it that time to adjust. In addition, you'll want to engage an audiologist for assistance, because even if you do decide to purchase an over-the-counter hearing aid, if you decide to purchase one before, if you decide to consult with an audiologist before you purchase an over-the-counter hearing aid, that might be a good idea, because they may be able to walk you through what getting that hearing test, and may be able to allow you to understand what candidacy you have for over-the-counter hearing aids. So it's best to engage with the audiologist so that you actually know, am I going in the right direction? Is this something that will actually benefit me? And in order to, again, to understand that, we at CHC, Center for Hearing and Communication, have a free 15-minute consultation where you're able to discuss candidacy, you're able to discuss candidacy for over-the-counter hearing aids, which is great because, again, I think that you wouldn't want to pay for anything unless you understood that it was actually going to provide you with the proper benefit. So if you give us a call, we're able to walk you through the steps of candidacy specifically for you. And our audiologist will answer any questions you may have about this new category of hearing aids. And to schedule a consultation, you can give us a call, or you could use this link, which I'm going to put in the chat box. And that's it. So thank you so much for all of your time. And if you have any questions, I'd definitely be happy to answer them.
Just quickly before we go to questions, or maybe you can stop sharing or make that bigger if you want to leave it up.
Okay.
So just quickly before we go to questions, I'm Michelle DeStefano. Some of you joined later. I'm the Director of Audiology at the Center for Hearing and Communication. I know some of you joined later because I was admitting you. I just want to make sure what Lauren was explaining earlier about optimal hearing is clear to everybody. Your brain gets used to the way you hear and the sounds you hear, whether it's with normal hearing or with any degree of hearing loss. And if you are fitting something for yourself, which is over-the-counter hearing aids, you're going to go what's comfortable, because those new sounds are going to be what your brain is not used to. So your brain doesn't know that everybody hears their hair or a face mask when you take it on and off as loud as it does if you have a hearing loss, even if it's a mild to moderate hearing loss. Your brain doesn't know that when you're walking in heels, it's very loud. And so you put on the over-the-counter hearing aids and fit them yourself, and you feel like, oh, I'm hearing my hair, that's too loud, or I'm hearing my shoes, that's too loud. that's not optimal hearing for you if you're only fitting it to what's comfortable. So an audiologist then, as Lauren said, when they're doing prescription hearing aids, is really pushing your brain to do what's best for it, given your hearing loss. And that might be that you're hearing your shoes at the appropriate level and can tell it's your shoes, but not what your brain's used to. And as Lauren said, it takes like a week or two to really get your brain used to that and your brain acclimated. So I just wanted to make sure, because some people came in later, that they understood what optimal hearing is. Whether you're going for a prescription hearing aid that is a basic hearing aid, so a lower cost, a high-end technology hearing aid with a higher cost, or even the over-the-counter, it's important that the brain gets the stimulation it's supposed to have. And that's not always achieved when you're fitting it yourself through over-the-counter, because your brain goes for comfort. If it's annoying, you want to remove it. It's almost like if you've ever had an injury and have to go for physical therapy. You don't want to do that movement because it hurts, but your body has to do that movement so that it doesn't eventually hurt. It's the same idea. So I just wanted, before we get to questions, I just wanted to make sure that everyone was clear on that, and clear on what she was saying by perceived hearing loss. You might feel like you're having trouble hearing and go for an over-the-counter hearing aid, but you may not necessarily know to what degree you're having difficulty. And that's why it's important we feel at the center, to get a hearing test first. Even if that's your first step, get a hearing test with an audiologist and then go from there on how you want to treat it. Okay, now we can open up to any questions or concerns. If you have any questions, you can put them in the chat, or we can open up the mic if there's questions as well.
Go ahead. We have a question here.
I have a comment. Can you hear me?
Yes.
Okay. Hi. When I started college at age 19, that's when I lost my hearing. And at that time, I didn't have any hearing aid. I didn't have any surgery. And some people, instead of talking louder or repeating what they were saying, they chose to ignore me. And it made me feel very lonely, very isolated. This is what happens. Some people are like that. The other thing is, as my doctor told me, as you get older, you get nerve deafness. Is there anything that they can do about nerve deafness?
So okay.
Lauren, can you just stop sharing the screen so they can see you a little bit better too?
Oh, of course.
Done.
Okay. Okay. So, I'm really sorry that was your experience and that you had that. I mean, that is something very difficult to go to. So I definitely sympathize with you. As far as nerve deafness, so there are different types of hearing loss, and the one that I think you were experiencing, based on what you were saying, is something that goes in the inner ear. In the inner ear, when there's hearing loss there, it tends to be permanent. So because of that, that permanent damage that you would have received, our treatment, our management is really to go for hearing aids. So that's why I've been mentioning, the difference between the over-the-counter and the prescription hearing aids, because with prescription hearing aids, you really are, we're determining, what hearing loss you have. We're determining the type of hearing aid that you need. And with over-the-counter hearing aids, you're not knowing what type of hearing loss you have. So you don't know what's necessarily appropriate for your loss. Whereas with the prescription ones, we're actually able to know, okay, this is what we're going to do. This is how we're going to treat your hearing loss. So really, to answer your question, you would manage your hearing with hearing aids in this instance. I don't know if there aren't necessarily ways to improve hearing with medically is what I'm trying to say. Michelle, I don't know if you wanted to add anything to that.
Just to add to that, not everyone will have hearing loss from your nerve damage. There's different degrees of hearing loss. There's different types of hearing loss, as Lauren said. The best way to really know how much you'll benefit from amplification, regardless of the type of amplification, whether it's an over-the-counter, whether it's just headphones to make your television louder, whether it's a prescription hearing aid, is to really go get a hearing test and see an audiologist. Because some people just need volume and some people don't. Some people lose clarity of speech.
I have been through the ringer. I know all about that. I'm a senior now. And I don't believe in the over-the-counter hearing aids. I don't, because you're taking a chance and they're expensive, and I would never get it. I was very lucky 2 years ago to go to this audiologist, Lois Benedetto. She was so smart that she figured it out for my insurance, how I don't have to pay anything. And with Medicare Advantage, she figured it out, so I didn't have to pay anything.
Right. So the thing is that a lot of insurances will cover hearing aids to some extent.
We also there's some other questions. I just want to make sure now we can come back. Marilyn, you have your hand raised.
Yes. Do you recommend specific hearing aids based on the specific situation? I just had a hearing test a couple of weeks ago. I know I need a hearing aid, and any professional would be able to see the areas of weakness. In a case like that, are you able to recommend, hey, get this one or that one?
So at CHC, we don't typically just pick a hearing aid for you. We work with all major companies that do prescription hearing aids, and we like to do a hearing aid evaluation. So we like to actually have you come in, try out the different hearing aids, test you with words with the different hearing aids, see which you perform the best with, see what sounds most natural to you, and then pick that hearing aid that you do the best with. There are audiologists who will just say, oh, I work with this company, you should get this, or this is a hearing aid that works for your hearing loss, you should get this. But in truth, you can give me, your hearing loss can be exactly the same as someone else's, and you might do much better with one versus another compared to the other person. So we work with all major companies. There's about 6, but we tend to actually evaluate them with you first before just choosing.
Got it. Okay.
And so that would answer the question a little bit that's in the chat from Nan, which is, are there devices in either or both categories, over the counter or prescription, that give a more natural sound? Yes, is the short answer. Technology has come a really long way. It does depend on your hearing loss and how long you've had an untreated hearing loss, but the technology that's out now it's a digital chip. It tries to really make the sound as natural as possible. The audiologist's knowledge of programming it tries to make the sound as natural as possible so that it's not robotic. Background noise should not be louder than the person speaking. It shouldn't be you're sitting at a restaurant and you hear dishes clanking at the table next to you over the person who's at the table with you. All those things shouldn't occur any longer. Is there any other questions? Or Nan, did we answer your question? You could type in the chat if you have a further question from that.
You have somebody else here who wants to ask? Go ahead.
Sure.
Hi. I'm actually a retired speech language pathologist, and I've been down to your place. So is someone, the nurse here. Well, she was the nurse here. Is there a chance at some point that Medicare will start paying for the prescription aids? Is the organization ASHO or some other organization trying to push for that?
Want me to answer that? So there was a lot of talk of that, and it was an actual attempt before this last decision came down. But at this point, there's no news that's going to happen. It would be nice, but there is no information that that's happening. I actually am on the board, the audiology board at NISHLA, and we're very involved in a lot of the government lobbying and decisions and part of that. And so far, we have not really heard anything that is going to change, unfortunately. We can tell you that the managed
Medicare plans.
Medicare plans that are supplementals are starting to kind of partner with these third-party insurances that will cover some portion or have like a discounted hearing aid option. But Medicare itself is right now only covering hearing tests, and they do cover hearing tests, but that's it. It would be nice.
Does anyone else? Oh, yes.
Another question. I have, anyway, about if somebody wants to try to combine using an audiologist with an over-the-counter hearing aid. Let's say they have their hearing tested, and so they know, what their hearing is, and then they buy an over-the-counter, and then they want to be counseled by an audiologist. Is that how much? I'm not sure how to put it, but it sounds like you're saying the audiologist will do that now. They will agree to work with someone who has an over-the-counter hearing aid.
You want me to
It
answer that?
depends on the person, on the audiologist.
Yeah, I got it.
Okay.
So it depends on the audiologist. At CHC, we have made the decision that we will support the use of over-the-counter hearing aids when warranted, because we feel something to help you communicate is better than not taking any option. And so, but that really depends on the audiologist. At the center, we do have, like Lauren said, the free 15-minute consultation. So you can send your hearing test and speak to an audiologist about what your options are, what you could get, what to look for with an over-the-counter, and if you are a candidate. We also have that will help with an over-the-counter fitting. So if you purchase an over-the-counter hearing aid outside, you can call to schedule an appointment, and we will help you for a fee fit the hearing aid itself, and then you wear it and see how you do with it. Sorry, hold on one second. But other than that, we can't tell you what other audiologists are doing. So CHC is trying to be as supportive as possible. Most of them you can purchase really through any Best Buy, over-the-counter, Walmart, Walgreens, things like that, Amazon. We are listed as what's called Jabra, which is one type of over-the-counter as a Jabra provider, if that's searched, and we do have the ability to work with that one.
Michelle, do you want to talk about, if there aren't too many other questions, do you want to just mention that, like, there are not that many products out there just yet, right? I mean, about four or five.
Right, it's at, I think there was one more hand raised, so I don't know if there was.
Yeah, I saw that.
Oh, two more. All right, so let's do questions first.
Okay.
Lauren, jump in whenever.
How good are hearing aid amplifiers?
So there are different levels of technology that are available to allow for better hearing. Amplifiers it's not programmed again to your loss. It's just making sound louder. It's making all sound louder. So it's not going based off of your hearing loss at all. Whereas with an over-the-counter hearing aid and with a prescription hearing aid, you're fitting it to a specific loss. So amplifier would be subpar compared to something that's actually being fit and programmed for you. So I wouldn't, so for a person who has a hearing loss, I would not recommend it. I would really go for something that's tailored to you. And yes, Lynn?
Yes, since this is a new field, what has been the general consensus of people who have bought over-the-counter hearing aids?
So yeah, we don't really, we haven't had that data yet. It's very new. So we're not sure, but as Nan said, a few people said that their voices sound unnatural. So, you know, that's new, you know, as more information comes in, we'll be able to determine what specifically is, you know, going on with over-the-counter hearing aids. But unfortunately, we don't have that yet.
Thank you.
You're welcome.
I mean, the only thing I was gonna say is like, before this new law went into effect and these new products are now available, there really wasn't any regulating body for devices to help people hear better outside of an audiology practice. So these products have in general been available for years online and in drugstores. I'm sure you've seen like the $29.99 hearing aid that's available on a drugstore shelf. Those are all unregulated. And the one good thing about OTC hearing aids is that the products are designed with following very specific guidelines that have been designed with a lot of input. And maybe there were some compromises here and there about the specific requirements, but in general, it's better to buy an over-the-counter hearing aid than just some random amplifying device. So my suggestion is to really take the time to read the packaging, make sure if you are going to buy an over-the-counter hearing aid, make sure you really are buying an over-the-counter hearing aid that has the FDA labeling on it and has very clear information about what you are purchasing, because you might unintentionally pick up something off the shelf that is not actually considered an over-the-counter hearing aid. And we kind of know things are going to be a little confusing for a couple of years. I don't think it's going to be so straightforward. So I hope today was a little more informative than where you've been about this category. We're happy to take more questions, but at the same time, you're the first group that's received a presentation from us on this topic. So if you'd like to give us any feedback about anything that maybe we should touch on more going forward, or anything we should be clarifying a little bit better that maybe wasn't as clear, we're very happy to get that feedback either now, or send us a message, or speak to Margie and she can convey that information to us.
And then I just want to add, if you feel like you are experiencing any of the difficulties with hearing that Lauren mentioned, that you're having trouble with your television, your telephone, and you have not had a hearing test, you could at least do the free hearing screening on our website, which kind of tells you if you have to go further. You can you click on our website, you put on any headphones, and then you can take that hearing screening and it'll tell you everything's fine, you're great, or you know what, you really should look into this further and get a hearing test. And at least that's a first step in your hearing health. I think there might be another question.
Not a question. It was an excellent presentation. Lauren was wonderful.
Thank you.
I liked all the slides. I forget what they're called.
PowerPoint slides, yeah.
But it was very, very well done. Thank you.
Thank you.
What is your website?
CHC.
Oh, thank you, CHC.
Hearing.org. You want to just share that last slide again, Lauren?
Is
So
it
they can see it?
CHC hearing?
Yes.
Hearing,
Oh, okay. Oh, it is, yeah.
okay.
We put it in the chat. Carolyn put it in the chat, and then Lauren can put up that last slide too. We can see it again.
Yes. share.
We have like 1 or 2 more minutes. Is there any feedback, any other feedback? Any constructive feedback that you think we should consider for the future? Or any other topics you would like us to consider presenting on in the future? Because we enjoy coming to your site. We've done some talks over the last couple of months on hearings, so. Okay.
Maybe I don't know if you have time to add, not today, I mean, but, things little tips for people that are hearing impaired. I don't know if you included that. Like where to sit
Oh, we have to
in a
go.
restaurant.
Oh, okay. Unfortunately, we have to
Sure.
stop and, we have a 2 o'clock, and we have to go.
Person's face, stuff.
Yeah,
like that.
some communication strategies. Absolutely. That's a good idea.
Okay.
Thank you.
Okay, so unfortunately, I hate to do this. We got 2 minutes. We got another Zoom coming up behind us. So, but thank you so much for coming. We really enjoyed it and we look forward to seeing you guys again.
Thank you. We enjoyed
care.
presenting, so anytime.